How to identify palindromic rheumatism flare-ups. Imagine experiencing sudden joint pain that appears out of nowhere and then disappears just as quickly. That's often how palindromic rheumatism flare-ups present. These episodes are characterized by quick onset of joint pain, swelling, and inflammation that usually last from a few hours up to 3 days. During a flare-up, the affected joints become painful, stiff, tender, and may feel warm or look red. Sometimes, small lumps or nodules can appear under the skin during these attacks. What makes palindromic rheumatism unique is that these episodes are brief and completely resolve between attacks, leaving no lasting joint damage. The episodes tend to recur unpredictably, with some people experiencing several attacks a day, while others might have only a few each year. The pattern can change over time, with symptoms shifting from one joint to another, often involving small joints like those in the hands and feet. In addition to joint symptoms, some individuals may feel tired or mildly unwell during flare-ups. Mild fever can also occur, but systemic symptoms are usually less severe than in other types of inflammatory arthritis. The inflammation may affect surrounding soft tissues such as tendons, adding to discomfort. Because there is no single test to diagnose palindromic rheumatism, doctors relying heavily on observing symptoms during attacks and taking detailed patient histories. To help with diagnosis, healthcare providers might perform physical exams during an attack to look for signs of inflammation. Blood tests can help rule out other conditions like rheumatoid arthritis, which tends to cause more persistent joint damage. Imaging tests such as X-rays or ultrasounds can also be useful to assess joint and soft tissue involvement, especially if the diagnosis is uncertain. Recognizing these flare-ups is important because palindromic rheumatism can sometimes develop into rheumatoid arthritis over time. Early identification allows doctors to suggest appropriate management strategies to reduce the frequency and severity of attacks. Keeping a detailed record of episodes, including when they happen, how long they last, and which joints are involved, can be very helpful for your healthcare team. In summary, palindromic rheumatism flare-ups are sudden, brief episodes of joint inflammation that come and go, often affecting small joints like those in the hands and feet. Symptoms include joint pain, swelling, stiffness, and sometimes systemic signs like fatigue or mild fever. Monitoring and documenting these episodes carefully can help your healthcare provider determine the best approach to managing your condition. Always consult a healthcare professional for personalized advice and treatment options.